At Northampton General, patient safety is our #1 priority. More than 1 million people are treated successfully each day in the NHS, but sometimes unexpected and unintended events related to medical care can happen. We want you to work with us and help us avoid such events. Northampton General Hospital has signed up to a national patient safety campaign called Patient Safety First, and we are doing everything we can to eliminate avoidable harm. But there is a lot that you can do as a patient, a relative or a carer that can help us improve patient safety. My colleagues will be explaining the importance of telling us about your medical history and your symptoms in full. Knowing what medications you were on or bringing a list into hospital is really helpful. Telling us about your allergies or any problems that you've had with medications. Tell us about your previous medical histories such as diabetes, asthma, epilepsy or any family history that you think we should know. Check the details on your identity band, are they correct? And if your band does happen to fall off while showering, then please ask us to replace it. It's really important as this is the band that we will be checking when we administer any drugs or prior to any procedure. Check that your name above the bed is correct and let staff know if it's incorrect or has been misspelled. If you are pregnant or think that you could be pregnant, then make sure you tell one of our doctors or nurses before you have any treatment, operation or x-rays. And most importantly, please ask any questions if you have any concerns or require more information. Your safety really is our #1 priority.
Hello, I am a pharmacist at Northampton General Hospital and I would like to give you some information on how you can help us with your medicines. Whenever you come into hospital, including outpatients appointments, it is very important for us to know about all the medicines that you take at home. Not just your tablets, but also other medicines such as eye drops, creams, inhalers and injections, and even herbal medication that you may take. So please bring all of your medicines with you or an up-to-date repeat prescription list. When you and your doctor have agreed that you should take a new medicine, it is very important that we know as much as possible about what you are already taking and how you take it. If you come into hospital, a member of the pharmacy team will visit you on the ward most days, and we will be available to talk to you about your medicines. Please make sure that you tell the doctors and nurses looking after you about any allergies or side effects you may have had with medication in the past. When you are given your medication, make sure that the nurse checks your wristband and asks for your name and date of birth. Do not be afraid to speak out and tell staff if you think you have had or are about to receive the wrong medication. Before you leave hospital, you will be given a discharge letter, which will give details of any medication that has been stopped or started. Make sure that you understand what your new medicines are for, how long you need to take your medicines for, what side effects to look out for, and what to do if you get side effects. Please ask how to get more supplies and when you will need to see your GP for any follow-up or blood tests. If you need help taking your medicines at home, please let us know. When you get home and some of your medication has been stopped, take any unused supplies back to your local pharmacy to avoid confusion and so that the medication can be disposed of safely. If your medication has changed, check that your GP has amended your repeat prescriptions list. We are here to help you with your medicines. Please do not hesitate to ask if there is something you don't understand about your medicines.
In this trust, we have a critical care outreach team. We are a group of highly experienced critical care nurses who also review acutely ill patients on the main wards. The ward staff use the early warning scoring system to monitor and identify when a patient is becoming acutely unwell. This is a system of numbers based on recordings of your breathing rate, pulse rate, blood pressure and conscious level. If your score is increasing, your doctor or nurse will call the outreach team to come and assess you. We may make suggestions to improve your treatment plan, assist the ward nurses with your care, or facilitate your move to the intensive care unit or the high dependency unit for a higher level of care. So, if the outreach team are called to see you, please don't be alarmed. We're here to help ensure that you receive the best possible care.
I am part of a dedicated team of nurse practitioners located in the anticoagulation department who look after people with blood clots. Any patient is at risk of developing blood clots in the deep veins in the legs. This is known as a deep vein thrombosis. These blood clots can break off and travel to the lungs. This is known as a pulmonary embolism. Within 24 hours of your admission into the hospital, the doctor will come and assess your risk of developing blood clots by asking you a series of questions about your medical history. If you have any risk factors, the doctor will discuss these with you and explain if you need any treatment to reduce these risks. Treatment is usually wearing compression stockings and/or a daily injection of blood-thinning medication called heparin. In addition, you can also help yourself to reduce the risk of developing blood clots with the following advice. Ask the ward staff if you have had your risk assessment for blood clots. Drink plenty of fluids to keep well hydrated unless otherwise advised by the ward staff. Get out of bed if possible and walk around as soon as your condition allows. If you are unable to get out of bed, the nursing staff and physiotherapists will show you a series of leg exercises you are able to do to encourage the blood flowing through your veins. Ask the ward staff to discuss your risk of developing blood clots and any treatment you may need. Remind the ward staff if your stockings are left off or if you have not had your blood thinning injection each day.
To make sure that your operation is completed safely, we have introduced a series of checks at various stages. This is called a surgical safety checklist. For your safety, the staff may ask you the same questions at different times to make absolutely certain that the right person is going to have the right operation. They will ask your name and date of birth, what surgery you are having, which part of your body is being operated on, and if you have any allergies. If you, your child, or someone you care for is going to have an operation, please check all the details on the consent form are correct before you sign it. The part of your body being operated on may be marked by a doctor before the operation. Please make sure that the correct part of your body is marked. After your operation, you will be looked after by a nurse on the recovery ward until you are ready to go back to the main ward. Please let the nurses and doctors know if you are not comfortable in any way, and they will do their best to help you.
Infections are caused by germs which we cannot see. These germs are on surfaces and all over our bodies. Normally, humans and germs live happily together side by side, and they do not cause us any harm. However, if we are unwell, admitted to hospital or following an operation, this makes us more susceptible to infections, and germs can readily get into the wrong place. At Northampton General Hospital, we are doing everything we can to reduce the risk of our patients catching an infection during their stay with us. But we do need your help. Hand hygiene is the simplest and most effective way to prevent infection. It is important that hands are washed with soap and water regularly and then dried properly. This should be done regularly, but especially before eating and after going to the toilet. Visitors must clean their hands on entering a clinical area where there are patients and before and after contact with the patient. Foaming sanitizer is at every ward entrance and at the end of every patient's bed to help with this. We encourage patients and visitors to ask staff attending them if they too have performed hand hygiene before and after contact with patients. Please tell staff if the foaming sanitizer container is empty. Please tell staff if you notice that any areas of the ward or the department are not clean. Patients and visitors can also help to keep germs in the right place by not touching drips, drains or catheters that may be put in during their hospital stay. This prevents germs from transferring from their hands. Please do not visit someone in hospital if you are suffering from a cough or cold. And do not visit if you have diarrhea and/or vomiting. Visitors should not eat or drink in wards and other clinical areas. Thank you for your cooperation. Together we can reduce infection.
Falls in hospital are the most commonly reported patient accident in the country. People may fall for a variety of reasons, including general illness, infection, and weakness that may have led to hospital admission in the first place. Disorientation due to being in unfamiliar surroundings, the effects of newly prescribed medications or tablets, and illness and balance problems. There's a lot that you can do to help us prevent you from falling in hospital. Please tell staff if you've fallen before, if you're worried about falling, if you feel unsteady on your feet, or if you feel dizzy, particularly when you get up from lying or sitting in the chair. Please let us know if you normally walk with a walking aid or tend to hold on to the furniture when you move around at home. Whilst you're in hospital, please wear your glasses and your hearing aid if you feel you need them. If you feel unsteady, please call the staff for help and use a walking aid if you need one. It would also be really helpful if you could ask the nurses to show you the call bell and to leave it within easy reach. It's really important to let your doctor know if you've had a fall and you don't know why you've fallen. For example, if you wake up or come to on the floor, or if you have a fall and had noticed beforehand that your heart was racing or pounding, or you felt giddy or dizzy, or if you've previously had a fall that led to a serious injury like a broken bone or fracture, or if you've had more than one fall in the past. Finally, please ensure that when you're in hospital you have your slippers or shoes with you and that they fit well and have non-slip soles.
Bedsores are also known as pressure ulcers. These are sores that result from continuous, unrelieved pressure against the skin that squash the blood vessels, thereby blocking the essential supply of oxygen and nutrients to the skin. This starves the skin and underlying tissues of essential oxygen and nutrients, causing tissue death, which results in a wound. It is a bit like placing a boulder onto a hosepipe that is a garden's only source of water. If the water does not get through to the garden, then the garden's grass and plants will wither up and die. Sometimes these wounds can be very deep and can extend right down to bone and tendons. Prevention of such wounds is much easier than trying to get them healed once they have occurred, as many factors often slow down the healing process and increase the risk of infection in these wounds. Nursing staff will carry out regular assessments and observe your skin for any signs of pressure damage whilst you are in hospital. They will implement preventative measures that will reduce your risk of developing pressure ulcers. If you can assist nursing staff to reduce your risk by carrying out the following preventative measures. 1. Keep moving. If you are sitting in a chair, stand or raise yourself off the chair to relieve pressure on your bottom, and we do this naturally without realising it in normal circumstances. Do not be afraid to ask nursing staff for assistance. 2. If you are in bed, move from side to side, and if you can, use the electronic handset to alter the angle of your backrest from time to time, or request that a nurse does this for you. We move in our sleep naturally every 9 to 11 minutes in normal circumstances. Do not be afraid to ask nursing staff for assistance. 3. Eat a good, well-balanced diet if you can. This will aid tissue repair. Nursing staff will carry out a nutrition assessment and may offer food supplements if your food intake is insufficient for any reason. Do not be afraid to ask nursing staff to assist you with your meals. 4. If your skin gets wet from either sweating or incontinence, it is important that you tell the nursing staff, as your skin will get sore and break down more easily if you don't. If you are worried about your risk of getting pressure ulcers, or if you are concerned that you may be developing a pressure ulcer, it is important that you inform nursing staff so that they can address your concerns.
Keeping you safe while you're in hospital really is our #1 priority. You will have noticed on the entrance to your ward area that there is a patient safety board and a patient safety leaflet which reinforces these important safety messages that you've been listening to. Thank you for your attention and listening to this patient safety presentation.